Hello, welcome back to our channel. We are the Bmssa. In today's video, we will be focusing on ALS, which is short for Amyotrophic lateral sclerosis. You may also know it as Lou Gehrig's disease. Firstly, what is ALS? ALS is a progressive neurodegenerative disease that affects the nerve cells in the brain and the spinal cord. This occurs by causing the motor neurons, the nerve cells in our body that facilitate movements and muscle control, to start to deteriorate and die. When this happens, the brain of an ALS patient will gradually lose the ability to initiate and control voluntary muscle functions, making it harder for them to eat, speak, breathe, and move. ALS is categorized in one of two ways. Upper motor neuron disease affects nerves in the brain, while lower motor neuron disease affects nerves coming from the spinal cord or brainstem. In both cases, motor neurons are damaged and eventually die. Signs of ALS usually begin at the hands, feet, and limbs before spreading to other parts of the body. Symptoms include having difficulty walking or carrying out normal activities, tripping or falling, feeling weakness in the legs, ankles, and feet, slurred speech or having trouble swallowing, muscle cramps and having twitches in the arms, shoulders, or tongue, and cognitive or behavioral changes. Although the cause of ALS is not completely understood, recent research suggests that multiple complex factors contribute to the death of motor neurons. Specific risk factors for ALS have not been conclusively identified, but ongoing research is exploring the possible role of genetics and/or environmental factors. Some risks include hereditary. Familial ALS, also known as FALS or sporadic ALS, is the genetic mutation that causes ALS to pass from parent to offspring. This source of ALS isn't common, with only 5 to 10% of all ALS cases being hereditary. Age. ALS is not confined to any age group, but the likelihood of getting ALS increases with age. Most who develop it are between the ages of 40 and 70. Sex. There is no direct correlation between sex and risk of getting ALS, but males are 20% more susceptible to developing the disorder, according to statistics. Genetics. Gene mutation is the leading cause of ALS. SOD1 and C9orf72 are both genes responsible for most ALS cases. Mutations occur completely randomly. However, after a gene is mutated, it multiplies quickly and soon outnumbers healthy cells. Environmental. ALS is in no way spread from person to person. It is a chronic disorder that has no direct specified relation to any environmental factor. However, some lifestyles do tend to lead to a higher risk, although there is no consistent evidence to prove the risk factors. For example, veterans exposed to warfare toxin, athletes during strenuous physical activity, and people who smoke are statistically more inclined to develop ALS. While the average survival time for a person with ALS is 3 to 5 years, some patients may live up to 10 or more years depending on their condition. Unfortunately, ALS has no cure, but there are many treatments and interventions that make ALS patients' lives much easier and slow the progression of symptoms. Treatments and interventions can be separated into 3 categories: support, medication, and therapy. Starting with medications, prescribed drugs riluzole and edaravone both have been approved by the United States Food and Drug Administration, or the FDA. Edaravone is a medication for ALS that is administered through IV and is an antioxidant that prevents damage to nerve cells from toxic substances. Some of its common side effects are bruising, unsteady walking, and headaches. Riluzole is taken orally and helps reduce damage to motor nerves by lowering the amount of glutamate in the body. Common side effects are gastric distress, dizziness, and bruising. These drugs effectively reduce damage to motor neurons by decreasing levels of glutamate, a neurotransmitter, also known as a chemical compound, responsible for transporting messages between nerve cells and motor neurons. Medications have the power to reduce symptoms and prolong the life of diagnosed patients. However, they cannot reverse any damage already done by the disease. Perhaps the most popular treatment for ALS is therapy. Therapy is used to enhance a patient's independence by strengthening the muscles and systems affected by ALS. Patients are offered a range of therapies from speech to physical. Lastly, ALS patients can rely on interventions such as more physical breathing support and/or nutritional support, which consists of aid and advice from medical professionals to improve the health and, more specifically, the diet of ALS patients. As the disease progresses and worsens, ventilation can be used to aid in breathing, and feeding tubes can be used to aid in safely eating to prevent further risks and side effects. We can help ourselves and others by reading and supporting scientific research for ALS through the websites linked below, which seek to help us understand more about the disease. Thanks for watching. If this video helped you, leave a like and subscribe to the channel for more information about different illnesses and diseases. Remember to turn on the notification button to be notified when our next video is posted.